Riding ATVs can be fun, but can also be incredibly dangerous. There are over 500 fatalities per year and over 100,000 emergency room visits per year due to injuries related to ATV accidents. 1/3 of all these injuries are children under the age of 16. Yesterday, I presented the case of a 21-year-old man who was riding ATVs with his friends at night in the dark. There was several riders, they were intoxicated and having a good time. When they returned home, they realized that their friend was no longer with them. They went back out into the woods and found him lying by a tree and was unresponsive. Upon arrival by EMS, he was a GCS of 7. The GCS I have gone over before, but that's called the Glasgow Coma Score. It's a way that we classify the severity of a head injury patient. We evaluate their eye opening, their speech, as well as what they can do functionally with their arms and legs to determine a score. A GCS of 15 is completely normal and a GCS of 3 is near brain death. A GCS of 8 or less means the patient cannot safely protect their airway and needs to be intubated. When this patient arrived to our emergency department, his GCS declined to 4. He was emergently intubated and sent to the CAT scan. This was the CT scan of the brain performed in the emergency department, and what we see here is a large epidural hematoma or bleeding underneath the skull. What we see on the bone windows is extensive injury to the orbit with multiple fractures throughout his sinus and eye, as well as extensive fractures of the patient's skull. He sustained severe blunt trauma to his face and head, sustaining a skull fracture as well as multiple orbital fractures. You see, this part of our temporal bone right above our ear is a very thin piece of bone, and lying right underneath it is called the middle meningeal artery, or an artery that supplies our meninges. If you sustain a fracture to this bone, it can lacerate the artery and cause acute bleeding. It can cause rapid bleeding between the brain and the skull and will cause the patient to lose consciousness. Classically, we describe an epidural hematoma patient as having a lucid interval. Basically, what happens is the patient may be knocked unconscious from the initial trauma and then wake up. And then as the bleeding artery continues to bleed and compresses the brain, they will then go unresponsive again. At that time, their life is on the line. A bleeding artery of that magnitude can cause death within minutes to hours. On our patient scan, we see this large white collection of fluid, which is the active bleeding from this skull fracture right here, and it's causing midline shift of the brain of 12 millimeters. What's happening is this amount of bleeding is pressing on the normal brain and pushing it over to the other side. If it continues to grow, it can actually shift and cause compression of the patient's brainstem and cause brain death. The answer to my question is this patient needs to go to surgery right this very minute. I took this patient to surgery and made a trauma question mark type incision on the patient's scalp, reflected the scalp down, and then removed a section of the skull to locate the bleeding artery. This artery is technically not within the brain, but on the outside covering of the brain, so we never even have to see the brain. After we remove the blood clot that's compressing the brain, we find the artery that's bleeding and stop it. And at that point, the surgery is done and we can then replace the patient's skull and close the skin. The surgery typically takes less than an hour to perform, but if we do not get to this case quickly, the patient can die. We repaired his fractured skull and he went on to survive this injury and live a normal life. This accident was over 7 years ago and his only remnant medical problem from the accident is post-traumatic epilepsy. Otherwise, he is completely functional. This patient should never have been riding an ATV while intoxicated, and he should have been wearing protective gear, including a helmet. When riding an ATV, make sure you get hands-on training from a qualified instructor. Never ride on public roads or paved roads. In fact, most accidents actually happen on paved roads because these vehicles are meant to be off-road. Only ride with the appropriate number of passengers, which is typically 1 passenger, and riders under 16 years old should ride on appropriate youth models. Our patient is incredibly lucky to have survived this accident. Please remember all of these tips so you can ride ATVs safely. Another case of patient-focused and compassionate care. Stay tuned next week and I'll go through another case.